Even if you're not a new nurse, going into the ICU feels very overwhelming because the amount of critical thinking and little details that you need to know in the ICU is completely different from any other specialty. I was inspired by one of my coworkers who is not a new nurse but new to the ICU, and she was feeling very overwhelmed, and she's like, how do you remember all of these things? And it's literally just being there, doing it, learning it, and then repeating it. So I'm going to start a series where these little tips and tricks and things that you would literally not know to consider, you consider in the ICU. So I'm going to start with digoxin only because it's one of those medications that are tricky. Digoxin hates a low potassium, and once you understand the physiology of it, you'll never forget it, and you'll always remember to check the potassium before you give digoxin. Digoxin works by inhibiting the sodium potassium ATPase in your cardiac cells. Here's the catch. Potassium also binds to that same site that digoxin does. With a normal potassium level, it's crowding the digoxin at the site and it's keeping its effect in check. But when the potassium drops, suddenly those binding sites really open up and more digoxin is binding in, and suddenly the amount and dose that you gave before is doing a lot more today. This is one of the ways that a patient can go into dig toxicity without the dose actually even changing. So before you give that digoxin, go ahead and take a look at the potassium. If you're seeing that it's low, go ahead and talk to the provider. And also, if your patient is telling you that they're feeling off, that they're feeling nauseous, or they're seeing some yellow and green halos, definitely loop in that resident, that doctor, that NP, the PA, whoever you need to.